I believe very strongly that reform of our drug laws, basically legalization, particularly of marijuana and of most drugs, legalizing, regulating, taxing, and treating those who abuse them rather than incarceration is the way our nation should go. How I became active in terms of advocating for the use of medical marijuana and actually advocating for legalization of all drugs. To my mind, the place of government is not to put people in prisons, but to treat their problems. Marijuana has many uses, and I have given about, in the neighborhood of 200 recommendations to individuals which allow them to become medical marijuana patients. And the stories, when they would come back for a renewal after a year and to renew their card, the stories that they would bring of being on Percocet or other prescription narcotics and being able to either cut down markedly or else eliminate their use of narcotics completely because of their use of medical marijuana are overwhelmingly positive. Unfortunately, the Drug Enforcement Administration and the federal government generally has been so restrictive and so against the use of marijuana that they have not allowed very much widespread legitimate research. And so it's hard to get research, but the research that is there, as far as I know, overwhelmingly indicates that marijuana is not a dangerous drug, that it has perhaps the addiction potential of caffeine, and that side effects generally are minimal as compared with, say, alcoholic cirrhosis or the 400,000 deaths per year in this country from nicotine-related respiratory illnesses. It is a far safer and in many ways much more effective drug. With alcohol, for instance, you get aggressivity, you get road rage. With marijuana, there's more of a mellowing out.